mechanisms. So what we are going to do now is we are actually going to go into a workshop that will be conducted by James Osborne. So James, if you could come on up and take the floor now. And the title of the workshop is Recognizing and Preventing Sports-Related Concussion, What Athletes, Parents, and Coaches Need to Know. James's bio is in your program. I'm not going to read exactly where he has been and what he has done, but thank you so much. I really appreciate it. I'll hand it over to you.
Thank you for attending today. Just to kind of give you a little bit of a background as to the purpose of the presentation you're going to see. I was a women's coach, girls women's coach for 30 years basketball. Listening to the panelists today and hearing about Title IX and how things changed for female athletes, and it took a while for things to filter down to them. That's one of the things that got me interested in doing this presentation on sports concussions, because there's been so much written and in the media about sports concussions, and you hear it at the NFL level, you hear it at Major League Baseball level, and it's very, very typical that whenever something gets into the public awareness like that, it starts at the top and it takes a while to filter down. And that's one of the reasons why I put this presentation together, because the presentation is geared toward parents, and it's geared toward specifically youth league parents. There's the new law in Pennsylvania, which takes effect in July, about parent education, and also the requirement that they have to have a doctor's note and go through the management stage before they can return to play after a concussion. That particular law is effective for public schools only. So private schools are exempt, private academies are exempt, and little leagues, youth leagues are exempt. So that's the target audience of the presentation that I'm going to be going through with you. That's the group that we need to focus on, because we don't want them left behind, and we don't want this training to take place by the time we get to high school. A lot of the damage has been done. So as I go through this with you, you're going to see, I'll insert a few examples as to what the reasoning was behind each of these steps that we're going to go through. And the first slide, I think, coming up, obviously what coaches and athletes and parents need to know. And a handout was given to you. The first part of that handout, there's just a summary article that you can read when you get a chance. But you flip the page and you look at the pretest. Okay, I decided that I wasn't going to ask you to answer that in single-spaced paragraphs. I figured it would be long. So, but take a look at that. I want you to read that as I go through it, and you can put down what you think is the proper response to that. And as we go through the presentation, you're going to be able to see and pick out what you think or what should be the proper answer to that. It's only a concussion if there's a loss of consciousness for 10 seconds or more. Okay? Just answer them as we go through, and then we'll come back to them later on at the end of the presentation. If one symptoms have disappeared, a return to physical activity can resume. Students may return to school anytime after they are symptom-free, even if physical activity is restricted. Second impact syndrome means someone is more prone to concussion after suffering previous concussions. The return of baseline cognitive abilities are the first sign that concussion recovery is complete. There is no evidence that returning to school immediately after concussion symptoms have disappeared slows down recovery. And it's true and false on this. And children and adolescents recover quicker and with no lasting effects from concussions. Now, the version of the presentation that we are doing with parents obviously begins with that. We can go to the next slide. Now, prior to this, we want to grab the attention of the audience. We have a video that's called that's from actually the NFL, which is about head-to-head hits. And it shows very graphically with a test dummy and a football player helmet hits, and how many G's somebody sustains when there's one of those hits. And then they graphically go and show. It's one of those clips that you don't try this at home kind of a thing. It's showing a sledgehammer and a cinder block and saying how they're very similar to the kind of hit this particular football player and this test dummy had. So we usually try to draw their attention with that first clip and get the parents to be thinking about how violent one of those hits are to the players. So if you look at that, 2 back-to-back hits in practice or a game of 80 Gs and 90 Gs, 98 Gs I should say, equal like hitting the windshield in a 28-mile-per-hour crash at 100 Gs. All right, and we're going to go on and see how many types of hits happen during a typical practice as well. Lower impact hits in themselves, not normally damaging, can cumulatively result in a concussion. So it might be just a very minor hit or a bump, but the more cumulative they are, they can sustain a concussion in that instance as well. All right, next one. So according to the CDC in the year 2005-2006, so the data for that 1 year, there were 168 concussions in the U.S. per 100,000 student athletes on a daily basis. So this is nationwide on a daily basis. That's just that 1 year. Okay. And many of these happen in practice. And stop and think of how many hours players are in practice at the high school level, the college level. It's not so much at the youth league level. They may get 1 or 2 times a week practice time. But we're going to talk a little bit about some of the safety issues that we need to be concerned about. And I'll kind of throw in a few things as far as my years as a coach concerned, some of the drills that we would run in, and how I think maybe we should modify some of that stuff. Okay, go to the next one. So if you want to look at a breakdown of concussions per 100,000 athletes by sports, okay, again, for the data that we had available to us, 2005-2006, you're seeing for boys, football obviously is the biggest one. All right, football is the biggest, followed by soccer, basketball, wrestling, and baseball. For female athletes, soccer is the biggest one with 36. Basketball, balls, softball, and volleyball. What's not on that list are other things that are sports related. Cheerleaders. How many cheerleaders have fallen from a pyramid or from a throw or a toss? That statistical piece is not there. So there's many other sports besides the ones. Hockey's not listed there. All right. So that's just what we have data for. But the whole purpose of seeing that is to see how much of a problem it is nationwide for youth sports. Okay, go to the next slide. So it's a mild traumatic brain injury. All right. I work every day with brain injured clients. All right. And it's a devastating situation for them, for their family. All right. And many of them had much more serious injuries than some of the ones we're discussing today. But it's still a traumatic brain injury, mild but traumatic. All right. The risk of TBI is 3 times as likely after the first concussion. Okay, 8 times as likely after the third. All right, so you don't get any tougher. All right, when this happens to you, you're more vulnerable. In the year 2000 alone, the CDC estimates the loss of productivity due to TBI in the U.S. was $60 billion. That's just in 1 year. So when you think about that in monetary terms, it's really important that we look at how can we prevent, how can we treat traumatic brain injury, even if it's mild traumatic brain injury. Okay, you go to the next slide. So we want to address the issue. We want to address the issue in youth sports especially. How do you know your school and youth sports organizations are properly addressing the issue? That's a question that if you have children in youth sports, then you ought to be asking the organization that your child is playing in, whether it's a community league, whether it's a little league, whether it's a church league team, whatever the environment is, Find out what they're doing to address the issue. And that's one of the reasons I put this together, because I do training for an organization called Positive Coaching Alliance as well. And just listening to some of the coaches in some of these workshops that I do before and after the workshop, a lot of them are really scrambling and thinking, how am I going to address the concussion issue? How am I going to get training for my coaches? So that's another reason why I really felt this is important to develop this presentation for that group. Ask what the protocols are for staff training and management of concussions. So we're going to address that in just a moment. What are the protocols? What do they do if there's a concussion? How do they address it? Okay. Now the protocol should include these 4 parts right here. All right, education, prevention, recognition of the symptoms, and management. Okay. Management is a key critical point. We're going to talk about that more specifically in just a moment. So, for the education piece, training coaches in best practices. Once again, I'll give you some specifics in a moment. Teaching students the importance of sharing symptoms with a teacher, coach, or parent. All right, another thing we're going to talk about in a moment. Parent education and proper follow-up care after a concussion. Resisting the pressure to return to play until recovery is complete. There's a lot of peer pressure. There's a lot of pressure, sometimes by coaches, unfortunately, all right, and by the players themselves to return to play before they're ready. And some of them think they're ready. Implementing safe, developmentally challenging drills. All right, drills that are not going to have an inherent risk to them. Also, developmentally, when we talk about developmentally, okay, I was a classroom teacher. I taught 4th grade for 16 years. I had a 26-year career in education. All right, developmental. It's very important that we make sure everything that we're doing with kids is proper for their age and development. Okay, physically and mentally. So we want to make sure those are developmentally appropriate drills that we're using them. Now, understanding opinions on sports-related concussions. I was at a conference in New Orleans in September, and I met Dr. Julia Harbauer-Krupa, and we had a very nice discussion on some of the work that she's doing. She works with Children's Healthcare of Atlanta. Now, she's going to do a more comprehensive study, but this particular survey that she did at suburban Atlanta high school came up with the following results. Here's the outcome of the student, staff, and parents survey. 91% of the coaches could ID symptoms of a concussion. So I think most people would say that's a pretty good percentage to be able to ID, have 91% of the coaches be able to do that. Okay. 72% of the athletes could ID symptoms of a concussion. Also pretty decent for high school. 91% of the athletes told parents they had symptoms of a concussion, but not their coach. So that part's not surprising. Now, before we change the slide, we look at the 91% of the coaches that could ID the symptoms of a concussion. Once again, we're talking about high school and regulations that they had to adhere to. They're obviously going to train their coaches. All right. A lot of the youth leagues, the little leagues, as I was saying before, community groups don't have access to the training, probably didn't get it. That would be a much lower percentage, I can assure you of that. The other thing, 72% of the athletes, interestingly enough, she said that many of them got their information from ESPN or other sport magazines. And a lot of them had erroneous information. One student told her that he heard that you can avoid a concussion if you drink lots of water and stay hydrated. So she thought that was extremely humorous, and I agree. I mean, there's just so many of those misconceptions that they had of how you can prevent a concussion. But 91% of the athletes told their parents they had symptoms of a concussion, but not their coach. Obviously, they want to get back in the game. They don't want to be sidelined for the big game. They don't want to be perceived as not being tough enough. Whatever the case may be, they're not going to tell their coach. And what she was saying, of the people she surveyed, many of the parents said, well, you know, I had concussions when I was in high school, I'm fine. Okay, it's not a big deal. So they're going to tell their parents, and the parents maybe aren't going to tell the coach because it wasn't a big deal for them. Why should it be for their kids? So that was kind of what she was getting from them in that particular survey. So that's an important piece. She also, it was also interesting to me, and I was very surprised by this. She said that only 20% of the counties in the state of Georgia, where she lives, had adequate care in the way of having actual pediatricians available to the general populace. I was surprised by that. And she said a very small percentage of schools had athletic trainers. So the coaches had to really be educated and be able to handle most of that stuff themselves. Again, that gets into some of the budget things I think we talked about or heard from the panelists earlier. Okay, go ahead. So prevention. Let's look at the first of the four things. Prevention. Okay, using proper equipment. Okay, obviously football helmets, lacrosse helmets, hockey players wearing helmets, all those things are important. Appropriate practice test techniques. I can tell you with the techniques part right there, we also insert a video in here called Heads Up. Not Heads Up, but it's on heading. And basically what it is it's saying that, feet first, I'm sorry, feet first. And it's, the CDC has it available. And what it is, it's encouraging coaches to have their players head the ball less and use their feet more. All right. And there's a lot of varying opinions about heading the ball. Actually, Dr. Mickey Collins does not feel it's a damaging thing. All right. I remember my soccer coach in high school saying, "Oh, you hit it with your forehead. That's the hardest part of your head." There are some coaches that are saying, "Well, it has to do with you really have to work on your neck muscles and have it absorb the shock." There's research being done now about mouth guards. There's a lot of stuff out there, and they haven't really sorted that out yet. But the feet first video is one that we insert in there that kind of shows some techniques for doing that, using your feet versus heading the ball whenever you can. All right. So the scenario question that I developed here, and the reason I came up with that was when I was coach, I was a college basketball coach, head coach for 10 years. So I had to attend a lot of showcases, and I saw a lot of things like this happen, or heard players or parents tell me these situations. So I thought this was a good example. What would you do if your son suffered a mild concussion a week ago playing lacrosse for his club team, and he can't play until cleared by a doctor? So the club's doing the right thing. They're saying, return to play, we're not going to let him go until he's cleared by a doctor, okay? And he's symptom-free. All right? He tells you he's symptom-free. Okay? So your child, your son tells you he's symptom-free. All right? He appears recovered and wants to play in a showcase this weekend, being attended by college coaches. Should you let him play? Anybody want to respond to that? Should you let him play? Symptom-free. I feel great. I don't have any of the symptoms. Okay? No. I mean, he's going to want to play because he figures that's his shot to be seen by a college coach and getting a scholarship. And you might be tempted to say, yeah, he's been waiting for this showcase for a month now. And all of a sudden, you know, now they're saying he can't play, and I look at him and he's fine. Well, the answer is you shouldn't let him play. Because even though a lot of the symptoms may disappear, we're going to see as we go through this, there's a period of time where they have to be without any regression, all right? And that's very important. Management is probably the biggest part of the four things I mentioned, besides the education and other portions of it. All right, you can go to the next slide. Okay, so recognition of concussions, all right? Training athletic staff and volunteers to recognize the signs and symptoms of concussion. As I said, a lot of schools are doing this. It's a requirement in the state of Pennsylvania as of July 1st. And there are 38 states at last count that have laws in place about allowing players to return to play and having parents be on board with that, and having parents train and coaches train. and following an action plan if a concussion is suspected. We're going to talk about that in just a moment as well. Okay? So, typical concussion symptoms. A lot of you are probably familiar with this. Okay? Maybe some of you have had it alone. Concussion symptoms differ with each person and with each injury. It may not be noticeable for hours or days. Okay? And you're used to probably seeing some of this headache. That's something that you probably have heard before. Confusion, difficulty remembering and paying attention. Okay. Balance problems or dizziness, so it affects the vestibular system. Feeling sluggish, hazy, foggy, or groggy. Okay. Nausea or vomiting, bothered by light or noise. So being light sensitive is one that's pretty common. Double or blurry vision. Okay. Slowed reaction time. Sleep problems. And loss of consciousness. All right. And now loss of consciousness, some people think that, well, if that happens or it doesn't happen, I haven't had a concussion. Okay, you can have a concussion without having any kind of loss of consciousness. All right. Now, before I continue on that, you hear a lot of NFL players that are interviewed about concussions, and Steve Young is one of them. Steve Young played for the 49ers, had at least that they're aware of 10 concussions just as a professional over his career. 10 concussions. And Troy Aikman also had 10 or more. All right, and that led them to really start to think about retirement several times before they actually did retire. All right, so it's something that they both described, that foggy feeling, or sometimes weeks and months before they really actually felt fully recovered from their injury. Okay. All right, so screening for concussions. There are several tools for coaches and medical staff that have been developed to help them screen for concussions. All right. And it will help them with identifying and treating concussions. ACE, acute concussion evaluation, is one of them. Also, SCAT2, sports concussion assessment tools, is another one. All right. And IMPACT, which is pre and post testing of athletes. I'm going to talk about that in just a moment. Interestingly enough, you've heard that the old Apple thing, there's an app for that. There's actually an app for those. Okay? There's a sideline app a coach can have on a smartphone that has them not only helps them identify what the concussion symptoms may be, it has a series of questions that they can ask the athlete, and then they can ask the athlete again 20 minutes later or 30 minutes later, and it tracks it on the phone. Okay? And it's like $3. So I mean, it's a great tool, and it's just amazing the technology, how that can help coaches, especially coaches that don't know a lot about the situation, and having that available to them. It's really a tremendous tool. Okay. Now I'm going to talk about IMPACT. You can leave that screen up there, but I'm going to talk about IMPACT a little bit. Dr. Mickey Collins was one of the co-developers of IMPACT. And the IMPACT test is used by thousands of athletes nationwide. He's one of the team clinicians for the Pittsburgh Steelers and also the Penguins as well. So that test is a pre-test that's given to athletes. It takes about 20 minutes. A lot of schools are adopting it. There is some expense involved, but it's not very much. It's nominal, and there are also schools that are writing grants for that. But you typically see it at the public schools or academies. But it's really a test that's being used a lot. And the nice thing about it is when they take their test, you've probably seen it on TV. They've had some news reports on it. It's done at a computer, and there's tests of reaction time, and there's vision test. There's a whole gamut of tests that are done within the IMPACT test. And then what happens is if they do sustain a concussion, their results are on a disc. All right, so the athlete will take a post-test and then compare the results. All right, and that's just part of the assessment that the doctor will use. All right, So the impact test is really a great tool, and a lot of schools are starting to use it. Professional sports are using it. And that's something that if your school is not using it, you might want to look into that as an example. There are others out there, but that's just a typical one. So the protocols we've talked about so far, okay? We've talked about the 4 things dealing with sports concussions. And prevention, education, recognition, and management. I just want to mention one more thing on prevention. As a coach, I can remember years ago, we used to, and I was a basketball coach, so years ago we used to have a drill where we would practice a player taking a charge, okay? So they'd stand there and someone would be driving at them and they'd have to fall back. As coaches back in the day, we were more worried, and we actually stopped using that drill, not because we were afraid of them hitting their head on the court, which is crazy to me now as I think about it, because we were more afraid they were going to break their wrist when they fell back, and they'd be out for 6 or 8 weeks and would be able to play. But really now, the danger is, you know, a little head hit on the hardwood, and it might seem like it's consequential, but it was something that obviously could result in a concussion. So that is something that, as a trained coach, you want to look, is that drill safe? Is that something I really have to run? What's the risk to my player? All right, that's what we talk about when we talk about education, not just of what the symptoms are and how to treat, but we want coaches educated in proper techniques so we eliminate the risk. Now, keep in mind, you're not going to eliminate all risk of concussion or any kind of injury in any kind of sport. All right, we're not advocating that you do that because there's going to be that kind of a risk inherent in anything you do. All right, we're just saying, telling coaches is a safe way to go about it, and there's obviously the wrong way to go about it. We want to eliminate or minimize the risk. Okay. All right, so management. This is I feel this is the most critical piece, is the management part, and this is the part that's now getting more attention than it has in the past. All right, it's getting much more attention, and it needs to have that attention because this is the critical piece. We learn how to diagnose a concussion. We know when it happens. Now, how do we manage the recovery? All right. So, management of recovery time is critical importance. It's recommended that a neuropsychologist, all right, be consulted when possible for return to play. Now, when we say when possible, we're saying it's not always easy to get an appointment with a neuropsychologist. Okay? It could be weeks, it could be months. All right? I think one of the keys is to try to get more physicians trained in the management of concussions. All right, and not maybe be so quick to sign off and say they're okay, they can return to play. All right, be a little bit more conservative about it. But we're just saying, if you can do it, especially in a severe case, if you can do it, that's important to do. Now, there's a great book, and I have it listed on a handout that you have on the concussion crisis. And they talked to Dr. Mickey Collins, and he's dealing with a soccer player that's had a concussion. And it got to the point for her, she had to decide that she wasn't going to play anymore. All right, she was a college player. And you know, he said, do you want to be able to read to your children when you have children, or would you rather continue to play another year? That's the way he phrased it to her. And sometimes it comes down to that kind of a choice. So management is very important. Return to play issues are critical. Okay. All right. Now, Philadelphia has great physicians in the community, and this was a quote from the Inquirer and Tina Master and Matt Grady from CHOP. Okay. Before we can talk about sports, let's talk about school. Okay. And according to recent research, resting the brain for the first 24 to 72 hours, okay, following concussion are most important. All right. So, head rest. In other words, we don't want them to take a lot, to be doing a lot of cognitive activities. All right. Old school thought was you have a concussion, okay, you're not going to be playing and going to practice. Okay, you can go to school, you can spend 6 or 7 hours in school, you can do homework, you can work on your research paper or whatever it is you're doing, but you just can't play. Well, they're finding out, well, you really shouldn't be doing that either, okay? It depends, again, on the severity of it. But here's what they suggest, okay? This was Dr. Louis Bell, Chief of General Pediatrics at CHOP. His suggestion, okay, is when a child is symptom-free at rest, okay, begin adding cognitive activities gradually. All right? So, it could be 10 or 15 minutes of time using a computer or reading a book. It could be, and again, stop if the symptoms return. Okay, we're looking at, is there regression? All right? Return to school 1 hour at a time, working up to a full day. All right. Now, I think in the beginning, a lot of schools were putting the brakes on that idea. You know, they're going to come back to school, and it's going to be a risk of falling behind academically. But I think they're starting to fall into line more and understand that this is really a critical piece, and it's important. All right. And they find that most students that take their time returning to school are going to recover quickly. There's a statistical study that has proven that. They do end up being able to return sooner if they take their time during the recovery, all right, rather than regress after coming back too soon. Okay. So, head rest. Talking about head rest again. Okay. Some symptoms of concussion make the brain work of listening, thinking, and learning difficult. Now, I work with brain-injured clients every day. And sometimes, to be honest with you, my training and background as an elementary school teacher really helps in that regard, because when you're asking questions of kids, sometimes, you can't be too quick to say, okay, well, somebody else, and you know, let's see if I can have someone else answer that question. You have to give a certain amount of wait time. You know, let them stop and think and formulate their answer. Take time. You ask them a question, give them a few minutes. There you go. Well, I see this with brain-injured adults, all right? Not all of them, but many of them. If you ask them to do something, okay, make sure it's a one, maybe a two-step direction sometimes, all right? If you ask them a question, you may be waiting 30 seconds to a minute to get an answer, okay? But that doesn't mean they didn't hear you, and it doesn't mean they don't want to answer you. It means that's how much time it takes them to formulate the answer. And cognitive thought takes energy. It's easy for you and I to do that. We don't think much about it. All right? But for them, it's really a critical piece. And it's the same thing with someone that's had a concussion. All right? Listening and thinking can be difficult, especially soon after the concussion before the recovery period is done. All right. So, in Canada, at St. Michael's College in Toronto, they developed a protocol called Return to Learn. And the person that developed that was their enrichment coordinator, Director of Learning Enrichment, Barbara Senji. It's a 6-step graduate program that includes the following things. All right. Full bed rest at home. So immediately following the concussion, full bed rest, okay? Really try not to do anything, all right? At least for 24, 72 hours if possible. Okay. Incremental introduction of class time, computer time, and homework. All right. So they're not going to all of a sudden have bed rest, stay at home, and all of a sudden go back to school the next week, and all of a sudden there you are doing everything at the same pace and level you're doing it before. So that's important. So students are allowed to progress to the next step only after being symptom-free with no regression for a week. So in other words, if they go back to school and then some of the symptoms return, they have to go back to the next square 4 if they're on level 4, whatever it was, they have to go back. It's got to be without regression. So that's very important. Okay. An administrator acts as a coordinator between parents, doctors, coaches, and teachers. All right, so they have an impartial judge so that maybe a coach that wants that player back isn't going to be pushing too hard to get that to happen, or to be influencing parents or someone else, or a teacher that feels, you know what, academically they're going to fall behind, they need to be in school, I don't see why they need to sit out so long. The independent person decides that and is the coordinator. Okay? And students that don't push themselves to the levels make better recoveries. So that's getting back to what I was saying earlier about taking the time and not pushing themselves too hard, because that's going to lead to regression and it's going to slow down the recovery. So some of the takeaways, and I put these in your handouts too so that you have these to refer to. But some of the takeaways from this presentation today include only a trained healthcare professional can evaluate and decide when someone can return to play. It's recommended that a neuropsychologist be consulted whenever possible. Again, a recommendation, not always possible. If you can schedule that, that's important. Management of recovery time, especially in youth and adolescents, is of critical importance. All right? Sure, it's important to ID the concussion, all right? But it's even more important to manage the recovery time. And though rare, second impact syndrome is a serious, often fatal condition. For that reason, doctors are especially careful about recovery time. We also have in the presentation we give to parents a clip on the Zachary-Lycett law that was enacted in the state of Washington. And Zachary-Lycett was a football player that was coached by his dad. And he sustained a concussion in a game. He had a hit that didn't really look that bad. He came to the sideline, said he was fine, didn't think there was anything wrong, and his dad put him back in the game. And then he took a relatively minor hit. They have video of this, a relatively minor second hit. And what happened was he developed what we call second impact syndrome. And second impact syndrome, it's kind of like the perfect storm. On a metabolic level, it's like a switch goes off and the brain starts to swell, and 50% of the people that end up with second impact syndrome die, obviously, and the other 50% are severely disabled. Now, Zachary-Lycett was severely disabled. He lived, all right? And his dad went on a crusade to start to make some changes. Obviously, he felt very guilty about putting him back in the game. So the Lycett law that was put into effect is probably the, I would say it's the template for a lot of the state laws that have been passed in the last couple of years. And that's, like I said, 38 states at this point and counting have established this law where parents, coaches have to be educated and have to sign a paper saying that if there's a concussion, then they will manage it appropriately and not let them return to play. So second impact syndrome is very, very serious. It's very rare, but it's not worth the risk. Okay. Youth and adolescent brains are especially vulnerable to a second concussion if not fully recovered. So we think kids are very resilient, and they are, but they also are very susceptible to second concussions, third concussions. So the brain's metabolic function is temporarily disrupted after a concussion. Even without developing second impact syndrome, on a metabolic level, a CT or MRI will not pick up any kind of damage, so that's why a neuropsychologist is really important to helping to diagnose and make sure that they're ready to return. But there's a lot of things that a CT or an MRI will not show, and that's why it's really important. But metabolically, it's not healed yet on a chemical level. Even if the more common symptoms such as headache, nausea, balance, or vision problems go away, they do not signal full recovery. So there are tests that a physician will do, a neuropsychologist will do, that'll help them narrow down whether they're ready to go back. Okay. Often the athlete's ability to evaluate the risk of return to play is impaired. Pressure by teammates, coaches, and parents can also enable this early return to play judgment by the athlete. Okay. Now, when we say they're impaired by the pressure by their parents and by possibly their coaches, and I should say peers, okay, more than parents, but their peers, their coaches, and possibly their parents. But oftentimes they're impaired because they really aren't thinking clearly. okay? They haven't mentally recovered from that concussion and they think they're okay. All right, so that's really, really important that we help guide them through the management stage. All right, and again, since we're talking about student athletes, rest and recovery includes reducing cognitive demands. Okay? Mental as well as physical fatigue has been shown to impact recovery time. So it's not just return to play, but return to school that should be considered. Improper management of recovery from concussion can affect not only a sports season, but also slow down a student's academic progress. So getting back to the scenario on that last sentence, that's what that references right there. A lot more is riding on his recovery, this lacrosse player in that scenario, than playing in a showcase. So it's very, very important not to let the pressure of feeling that you have to have a coach see you get into a situation where you shouldn't be on the field yet. Okay. All right. So if we look at the post-test, all right, and I just want to let you know that everybody that passes this will be allowed to have one. We'll make sure that's. I forgot to tell you that before. I'm sorry. So, true or false for each of these? It's only a concussion if there's a loss of consciousness for 10 seconds or more. That's false. Okay? Once symptoms have disappeared, a return to physical activity can resume. True or false? False. Okay? Students may return to school anytime after they are symptom-free, even if physical activity is restricted. False. Okay? Second impact syndrome means someone is more prone to concussion after suffering previous concussions. False. Okay? The return of baseline cognitive abilities are the first sign that concussion recovery is complete. What do you think? That's false. Okay. There is no evidence that returning to school immediately after concussion symptoms have disappeared slows down recovery. False. Children and adolescents recover quicker with no lasting effects from concussions. False. Okay. Many new state laws exempt private schools and rec programs from training, doctor's clearance, and return to play guidelines. True. Okay? So it's the public schools that are required to do that. Helmets will prevent most concussions. False. Okay? And the average age of children suffering concussions is 14. That's a tough one because we didn't really talk about that. What do you think? Think that's true? It's true. Yeah, that's the average age is 14. Okay. So anyway, that ends the presentation. I'll be around obviously throughout the day. People have questions, but like I said before, it's really, really important issue for me working in the field, and also I just feel that a lot of times youth leagues especially are the last ones to get this kind of training and attention, and that's what the Council on Brain Injury is trying to do, is try to get more of the word out there and opportunities for coaches, parents, and athletes to learn more about the issue.